Marlene Hassan Nahon said it's important to understand why, per capita, Gibraltar suffered 2 times as many COVID deaths as Linea and Algeciras. The Together Gibraltar Leader reflected on the 94 lives lost to COVID, a proportion of cases and deaths in our elderly residential services that, she said, far outnumbered even the countries worst hit by the pandemic. Ms. Hassan argued that the government's messaging on COVID was incoherent. She also said that any culture of entitlement is not the fault of the general public, but the fault of successive governments who've tried to outpromise each other at election time. She said it was outrageous for Mr. Picardo to call Gibraltar the spoilt child of Europe and point the finger at the public.
In Planet Picardo, the COVID pandemic has been worse than the closure of the frontier and the MOD dockyard together. It has been a seismic event, a meteor that has decimated our otherwise robust and healthy economy. In the real world, however, of the £1.7 billion of debt, only some £250 million can be attributed to COVID, which amounts to approximately 15% of the total gross debt. The government are clearly trying to sweep a decade of systemic economic mismanagement under the carpet of the pandemic and make us forget that the vast majority of the problems were already here before COVID existed.
Of the treaty negotiations with the EU, Ms. Hassan said she hopes a treaty with Europe can be agreed that brings mutual prosperity and a free-flowing border while respecting our red lines on sovereignty. But in the real world, she warned, deals only happen when all sides make concessions. She was critical of the tax measures introduced by the Chief Minister, describing them as kissing up and kicking down, the opposite, she said, of what a socialist government should aspire to do. Referring to the 5% rate for all income above £700,000 a year, Ms. Hassan said Gibraltar has a regressive tax system that allows the super-rich to get out of paying their fair share of the resources that our community so desperately needs. Ms. Hassan said the GHA is in a state of complete disarray.
Waiting lists are enormous. Appointments almost impossible to access. Phone lines saturated. Professionals overworked. Management is all over the place. Corners are being cut left, right, and center. Mental health services continue to be inadequate and overrun. And in the meantime, people are getting more frustrated, sicker, and more worried. The lackluster provision of our healthcare that never had the opportunity to really recover from the COVID pandemonium has become another serious health hazard for the people of Gibraltar.
She welcomed the Public Health Minister's comments that medicinal cannabis legislation will soon be brought to Parliament, but asked rhetorically how much pain could have been spared had the government taken her proposal on this seriously 4 years ago. Ms. Hassan claimed it was a budget of decay because she believes it'll mark the beginning of the end for the GSLP Liberals.